Hi, well, I'm going to take you on a journey, which I hope you love. And almost 5 years ago, I had cosmetic surgery. Age 53, I was starting to feel the effects of aging. So I had planned it in the UK until I discussed it with a Russian colleague of mine who knew a lot about surgery in Central Europe. The Asclepion Clinic, as an aesthetic nurse looking for standards and professionalism, stood out to me like a Belisha beacon. I loved it straight away. And 2 weeks later, I was standing outside about to go on a journey which was to become my destiny. I decided that I really wanted to offer my patients this too. However, we came across a big stumbling block straight away, and many patients said it sounded great. However, they didn't know what to do when they would come back, who would look after them, who would remove their sutures, who would check their wounds, who would hold their hands really to make sure that everything was progressing the way that it should be. So I developed Aftercare in the UK, which is an optional service. Today you're going to be able to see that with Bren. And Bren, thank you so much for coming in today. It's fab to see you. Your 6-month post-surgery.
Yes.
We were in Prague together in April. We're going to take our viewers on a journey of where you are now, what it's meant to you, what you thought of the surgery, and what you thought of the aftercare. I know you saw someone in Newcastle who felt that you needed more than Botox and fillers. Can you describe that situation, how old you are? Would you mind sharing that with us?
I'm 56, and I think it was a case of I looked in the mirror, didn't like what I seen. I'd experimented, I'd gone to a few places and things like that to see what treatments were available for me. I think I was told that I would probably need a facelift as opposed to just Botox or fillers and things like that. The lady that does her treatment, she gave me your number, and it just went from there.
Brilliant. Can we talk a little bit about the procedure itself?
Yes.
So we travelled together in April, and you had your surgery under a different anaesthetic really, was analgesia and sedation.
I had asthma. She said that a local anaesthetic would be better for me.
Okay.
And I'd never had that before.
Okay.
So I was a bit dubious, but she said, you know, she thought that would be the best thing for me.
Could you remember anything? Could you hear anything?
I couldn't remember anything. And afterwards, the recovery time, I felt so good. Afterwards, I didn't feel like I just
you don't feel like that drowsiness or sickness or anything like that.
No.
I know that you love the clinic. It's one of the largest clinics in Central Europe. It's won lots of awards. Can you tell me a little bit about it? Would you recommend it?
I couldn't praise it enough. The staff were English speaking. They were very friendly, very professional. I just couldn't fault it. It was fabulous.
Yeah.
And it was the first time that I'd been to Prague. You know, it's steeped in history, and it was just beautiful.
We had some fun together, didn't we?
We did, yes.
We came back and you invested in our aftercare programme, which is something that I developed with the surgeons, which we wanted to have to ensure that patients were cared for on their return to the UK. They wanted reports and photographs of their specific patients, and in terms of suture removal and how the healing was progressing. Was that something that you would recommend to other patients?
Definitely,
Okay.
because it's a case of, it's not as though you're going to a different country having surgery and then you're left, you're on your own.
Okay.
And I think it gave me a lot of reassurance.
The biggest question that our patients always say when they've undergone surgery is, you know, how long is this going to last? And the answer that I always say is it's down to you, because you need an enhanced programme. The surgery is only one part, and what I love at Beechwood is that we supply a treatment plan, and I think you've even had some treatment today, haven't you?
Yes, I have, yes. I've got a bit of treatment.
To maintain that, so that's so important. So it's something that for everyone who has a facelift, that I personally like to do that plan with them. So I'm always told that cost is something that, of course, people have to consider. Could you share with us about the financial aspects of having surgery? Because
Yes,
it is important.
I think I spent overall about 5,000,
Great.
and that was the lower
Okay.
face and the neck.
And that included your surgery, aftercare,
Yes, everything.
flights, and your accommodation. On average, a facelift in the UK can cost anywhere from a few thousand up to 10,000. I am so glad you've come today. It's so lovely to see you again. a big part of your maintenance is to see you at least every 6 months so we can maintain your surgery. And it's great to see you. Thank you so much for sharing your story with us. Thanks, Gwen.
Thank you.